Hello dear students, now we will be learning in continuation of the zinc phosphate cement in the part 2 that we are in the first part we have seen the introduction, the composition, the manufacturing method, the factors affecting the setting and the manipulation method. Two manipulation method we have seen, the conventional method and the frozen glass slab method. Both are very important. Now continuation we will start with the properties of the zinc phosphate cement which are very important. So in the first property, which is very important, is the biological property, which is that we have seen in the first part how the acidity of the cement is. So the main ingredient of the liquid is phosphoric acid, which is quite irritant because of the acidic pH. So if you see the timings at the end of the 3 minutes, 1 hour, 24 hours, and 7 days, you can see how the pH is at the end of 1 hour. Also, the pH is highly acidic, that is very less, that is 4. So it is causing irritation to the pulp and pain also. Now the degree of irritation, it depends upon how much the cavity depth is, means how much thickness of the dentin is remaining between the pulp and the tooth cavity. If it is very much near to the pulp, then you have to take care of your pulp by lining it with the help of your zinc oxide digenol cement, and which is having a neutral pH, and either a calcium hydroxide cement which is a alkaline pH, to prevent the irritating effect of the zinc phosphate cement liquid. Now coming to the rheological property, the mixing time of this cement is 1 minute to 1.25 minutes. The setting time is around 5 to 9 minutes. The consistency, yes, we are mixing it in a two consistencies, either in a lutein consistency or in a base consistencies, depending upon the use. In the manipulation only, I told you how we will understand the lutein consistency has arrived, that you will have to check for the loop formation. The loop should be it should be pulled, it should be form, and it should fall back on the glass slab, that is the loop is forming. And in the base consistency, the hook bend test that we have seen, I showed you the picture also. So you should understand in which consistency you will have to take the material according to the use, for which purpose you are using it. Then the solubility of this cement at the first 24 hours, it is very high, and after that it reduced to 0.2%. The high powder liquid ratio, if it is used, it is less soluble. Now, in the mechanical properties, this zinc phosphate cement is having a very good compressive strength as compared to the other cements. It is 80 to 100 MPa for type 1 and 100 to 170 for the type 2 consistency. The tensile strength is less, 5.5 and 5 to 14 MPa. The modulus of elasticity is 14,000 to 22,000 MPa. Now, what are the factors that affect the strength? Now, the powder liquid ratio, what does it mean? Higher the powder liquid ratio, there will be increase in the strength. And the water content. When the change in the water content of the liquid, either loss or gain, will reduce the strength. We have seen in the during the manipulation, the care that you should take care of your liquid, there should not be absorption of the water or there should not be evaporation of the water. For that, you should always keep the lid of the liquid bottle always closed. And when you are mixing, just before that, you have to dispense the liquid to avoid absorption or evaporation of the water content of the liquid. Because of this, it will affect the strength of your set cement. Now the next property is the thermal property. Zinc phosphate cement is very good thermal insulator. The adhesion, here again you will have to rely on the cavity. It adheres mechanically, there is no chemical adhesion. The cement, as the cement doesn't contain any fluoride in the composition, so it doesn't give any anti-carcinogenic property. So because of no fluoride in the composition. The material is radio opaque. That means when you shoot the X-ray and see, you will see the zinc phosphate cement as a white in color, opaque in color, because of having the property of radio opacity, because it contains the ingredient which is radio, which gives you radio opacity in the powder component. So what are the advantages of this cement? It is having a very good compressive strength. It is easy to manipulate if you take care all the precautions that we have mentioned in the conventional technique, that care of the liquid, thick glass slab, thick and full glass slab, then they're using a larger surface area, and how to add increment wise in the whole liquid, and each increment should be mixed for 15 to 20 seconds like this, and take the material in a required in the consistency for which purpose you are using. Take the material in that consistency. So if you take care all the precautions, it is not so difficult. The armamentum required are very easily available. They are economical, so it is easy to do the manipulation of this cement. It produces thinnest cement film of any luting cement. So this is the best property of this material. No other cement gives that much thinnest consistency to lute the crown. It is low solubility than silicate cement. Now, what are the disadvantages of this cement? Yes, it is because of the acidity of the liquid, it is highly irritant to the pulp. Then it is mechanically adhering. There is no chemical adhesion of this cement. No fluoride in it, so no anti-corrosive property. It is non-tooth color type of the cement. Solubility occurs in the oral fluid. Poor in tensile strength. So these are all other disadvantages property of this zinc phosphate cement. Now, what are the uses where it can be used? It is very good material to lute the indirect restoration and the orthodontic bands. I hope you know what are indirect restoration, or the restorations or the preparations. Once you do the tooth preparation, or once you do the inlay cavity preparation, you have to make the impression, then you'll have to pour the impression, then you have to prepare a die, and you will have to prepare a wax pattern and then cast it. You will have to invest the crown, do the burnout of the wax, and you will have to flow the molten metal, and then the casting that you received, you will have to do the finishing and polishing. So though that is everything is made in the laboratory, and that processes that you received, either a crown, full crown, partial crown, or inlays, onlays, that is made outside of the oral cavity. Now you have to just cement it with the luting cement with the prepared cavity or the prepared tooth. So that are all are the indirect restoration. So this is very good material to lute the indirect restoration or the orthodontic bands. Use as a cavity base or a thermal insulator base. Also use as a temporary or intermediate type of a restoration. So these are the three main uses of the zinc phosphate cement. Now let us come to the modified forms of the zinc phosphate cement. The first modified form of this cement is a hydrophosphate water settable cement. Now I hope I can give you little idea by the name of this cement only, hydrophosphate. Now hydrophosphate means what here? As we have seen the conventional powder liquid bottle of the zinc phosphate cement. Now here this cement is available in only one bottle. Now how it is available in one bottle? The powder will be there, and where will be the liquid then? So here the phosphoric acid, it is freeze dried, and it is after the freeze dried powder, it is converted into the solid form, and then it is fined into the powder, and that powder of phosphoric acid is added in the powder of the zinc phosphate powder. So this is in toto, means in the one bottle contains the powder components also, the liquid component also. Once you are using it, when you are manipulating it, you'll have to just add distilled water, and you'll do the manipulation of this cement. But this cement, the acidity remains the same as that of your conventional zinc phosphate cement. The other properties like compressive strength, film thickness, and the disintegration are inferior to the conventional zinc phosphate cement. And this is mainly used for luting and thermal insulating base. But this modified form is not become that much popular, as that's why it is not in use in the market. We use mainly the conventional type only. Then the second type modified form of zinc phosphate cement is the fluoride cement. Now, as we seen in the conventional zinc phosphate cement powder, there is no any fluoride content. But in this modification, the fluoride containing zinc phosphate cements are obtained. This is done by just adding a small percentage of a fluoride. And which fluoride is added? It is a stannous fluoride is added, which gives you a anti-kerogenic property. And that's why this cement most commonly known as a fluoride cement. But these cements have a high solubility, and this anti-kerogenic property is not that much so good, because this fluoride ion leaching that happens, it decreases in 1 or 2 days only. So that's why it is not giving you that much beneficial effects of anti-kerogenic property as compared to the other good anti-kerogenic cement that we will see in the further lecture videos. Then the third cement is a germicidal cement. As the name suggests, you must have been getting certain idea. Germicidal means either antibacterial or antiseptic property that is given to such type of the cement. So here certain silver salts or copper oxides are added in the powder of the zinc phosphate cement. So whenever the MCP is asked on the copper oxide cement, so it is mainly giving you the antibacterial property, because this such type of the MCQs I have seen that is asked, that is a copper oxide cement is having a property of. So it is a property of having a antibacterial property. So it gives you, so they are most popular with the name of germicidal cements. But such type of the cements are mostly used in the deciduous teeth where they are affected with the rampant caries, because these cements are also having an initial acidity which is more, so it is not that much popular and it is used very rarely, especially as I said in the rampant caries of deciduous teeth. And just remember that silver salts or copper oxide are added here to give antibacterial or antiseptic property, which are known as a germicidal cement. Now, the last and the fourth modification is the zinc silicophosphate cement. If you just see the name that I said just now, that is zinc silicophosphate. So you can see one cement name is hidden in this is the zinc phosphate. That is a modified form of it only. And the second cement hidden name is the silicate cement. We have just seen that how the silicate cement property is. The silicate cement is very good in aesthetic and it is having an anti-kerogenic property also. So this is a hybrid cement of zinc phosphate and the silicate cement. So it gives you both the advantageous effect of both the cement. Means here you will have to, what you will be getting, you will be getting a good aesthetic property and the antigenic property of the silicate cement. And for the zinc phosphate, you will have to, the main aim of combining these two cement here to lower the initial solubility and acidity of the zinc phosphate cement. Okay, but these cement are not that much has become popular because of the invention of the newer cement, that is the resin cement or the glass enamel cement. So that this type of the cement not in use in current days, and that is but it is a combination or a hybrid of zinc phosphate cement and the zinc silico phosphate cement. So this is all about the different modified forms of zinc phosphate cement. So coming to the end of the zinc phosphate cement, that it is an acid-base reaction cement with a moderate pH. It is a non-tooth colored cement, and because of its thin film consistency, it is mainly used for luting indirect restoration. And because of the low film thickness and low solubility, this cement is primarily used for luting the indirect restoration. It is used also as a high strength cement basis. So this is all about your zinc phosphate cement. These are the references from where I prepared the lecture. And the expected questions are: write in details about the composition, role of ingredients, and setting reaction and factors affecting the setting of zinc phosphate cement. The SAQs asked on this topic are: types of zinc phosphate cement, manipulation of zinc phosphate cement, frozen glass slab method, and the modified zinc phosphate cement. So dear student, zinc phosphate cement is very, very important from the second year point of view. So please go through it again. You will get it, and it is easy to understand if you revise it once again. Thank you so much.